Good afternoon, this is Melba Perez. I'm doing my head-to-toe assessment for class 6020 for the MSN program. My professor is Dr. Cruz. This is my patient. I'm going to explain to her that I'm going to check her from head to toe to make sure you are a healthy young woman. Right now, I'm going to look at your head. I'm going to feel your head. Is that okay with you?
Yes, ma'am.
Okay. I'm going to just look at the head. Okay, I'm going to feel it. I don't feel any anomalies, any bumps, any scars. I don't see anything. No nevi, no anything that no moles noted in the head. At this point, the head is normal cephalic. Okay, the next assessment is the sinuses. Okay, I'm going to start assessing for the frontal sinus. I'm going to just press this part of the head, and this is when you get a headache and you have a lot of nasal discharge, it may get uncomfortable. So I'm just going to press here. These are the frontal. Okay, and now these are the ethmoid and the maxillary sinuses. Do you feel any pain when I palpate any of this?
No.
Any nasal drainage coming out?
No.
Okay. So, and I'm going to check now the trigeminal and facial nerves. And I'm going to use a little cotton swab, and I'm going to have you close your eyes, if you please, and I'm going to touch certain areas, and you're going to let me know which areas am I touching.
Right corner of my forehead.
The forehead, and what am I touching now?
The left corner of my cheek.
And this?
The right side of my cheek.
Okay, so far this assessment looks normal for the facial nerves, and I'm going to ask you to, do you have any problems with your jaw at all?
No.
Okay, so any problems when you open your mouth? Do me a favor, open your mouth right now, as wide as you can, and go ahead and close it again. Close it, good. I don't feel any click, and the patient is denying pain upon palpation. When you go to sleep at night, do you have any like grinding?
No.
That you are aware of. Okay, that's negative for the mandible. No TMJ, patient denies TMJ. Now I'm going to check the eyes, the lacrimal duct, and the glands. So I'm going to check the lacrimal duct, which is over here. You can close your eyes if it makes you feel better. Okay, and right here, I don't see any discharge or drainage from the eyes at all. And I'm going to now check the conjunctiva. Okay, so I'm going to have you look up for me for a minute. Look up, and I see the conjunctiva, which is nice and pink. Once again, I don't see any redness or drainage from that part of the eye. I am not going to do a corneal reflex. At this point, this is not apparently necessary for this assessment. So what I'm going to do right now is do a visual acuity, and that's for the oculomotor nerves. And I'm going to ask you to cover one eye, and I want you to read these numbers. 14 inches more or less from the patient. Go ahead, read.
4, 2, 8, 7, 3, 9.
Good. Now cover your other eye and read the same numbers in reverse for me.
9, 3, 7, 8, 2, 4.
Okay. So what this tells me is that she has a good acuity, and it appears to be without any glasses. The patient does not utilize any glasses. She has at this point a 20/20 vision. Okay. Okay. Alrighty, now what I'm going to do is the optic nerve peripheral vision. What I'm gonna do, my dear, is go push you over here, and you're gonna let me know as soon as you see my hands from wherever it's coming from, okay? So I'm gonna go behind you. I'm gonna push you a little bit here, and you tell me when you see this hand. No, don't move, just look straight up. There you go. And you tell me when you see from your eyes my hand.
Right there.
Okay, and then I'm gonna do the other side. You're gonna tell me as soon as you see that hand.
No.
Now I'm gonna do it from the top, and you're gonna tell me when you see that hand.
No.
Now, and then I'm gonna do it from the bottom. Look straight, don't look down. Look straight, and you're gonna tell me when you see the hands.
No.
Now, okay, so she appears to have a good vision from above, bilaterally, and from below. Now I'm going to, oh goodness gracious, I need a phone. Do me a favor, give me a phone, puppy. Okay, turn on the light because I want to see. What I'm going to do right now is assess the pupil response. Thank you. So what I'm going to see is I'm going to shine this light, and I'm just going to see, just look straight. Look straight from, yeah, wherever, if you can see his arm, and focus on that arm. And what I'm going to do is just look at your, okay, very good. Okay, and I see a good response, constriction, and a consensual pupil constriction. So it's no need again for corneal reflexes. So at this point, this looks very good. Go ahead and you can turn this off for me. Thank you. Now, what I'm going to see, I'm going to check again the vision, what they call the 6 cardinals field of glaze. I'm going to move my finger around in a certain direction, and all you're going to do is follow my fingers. Don't move your head, just with your eyes. Okay? Okay, so look straight, and you're going to look at my finger. Okay? Just follow my eyes. Okay. Okay. So this appears to be, what I'm trying to test right now is the oculotrochlear reflex and the abducens nerve, and it has to do with the capacity to move the eyes in a specific direction. He can connect the vision, the eyes, with the object that's moving. I don't see any extraocular motor movements. I don't see any wiggling of the eyes at all. So far that looks very good. Okay, so you're able to focus on sight. Now I'm going to, well, really I don't have the instruments to look at the optic nerve, the disc, and the blood vessels, but I'm going to sort of utilize this as if this was the ophthalmic examination. Okay, what I'm going to look at the eye, I'm going to look at the optic nerve, the disc, and the blood vessels bilaterally, and I'm looking for any type of abnormality. So just look straight and make believe this is I wish if I could see it. I can't. I don't have what it takes. But it's a special instrument. I'm going to believe this is it. And what I'm going to try to see, if I see the fundus of the eyes, any vessels, any abnormalities in the vision, and I don't see any abnormalities. The vessels are intact, no bleeders noted. The next thing I'm going to do is I'm going to test the hearing. It's an acoustic assessment. What I'm going to do is I'm going to go and whisper some numbers or some words, and I want you to repeat them. I'm gonna say them I'm gonna move you a little closer because I wanna give myself some time. Okay. So I'm gonna whisper and you're going to tell me what you hear, okay?
Okay. 6.
3, 0. Okay, you can say it out loud. I'm whispering
Oh.
because I'm checking out to see how much hearing capacity or hearing loss do you have. Again.
5, 2. Apple.
Okay, good. So this young lady is able to have the capacity, the acoustic nerve to be able to hear the whispering that I do behind her. So I'm going to do also lack of things. A tuning fork. I'm going to also test the acoustic capacity, also bone conduction and air conduction. So what I'm gonna do is this is supposed to be a tuning fork, and what this does is that it sort of do and eventually dies down. So I'm going to believe that this is a tuning fork. I'm going to strike it, and it's gonna be doing do 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 do, and you're gonna tell me if you feel this movements.
I do.
Okay, good. And I'm going to go ahead and do the top of the head. You hear it, you hear it, and you feel it. Is that correct? Or you just hear it and you don't feel it? Make believe. So what I'm gonna do is I'm going to hit it, and I'm going to touch this little bone called the mastoid, and you're going to hear some sounds, hopefully, and you're going to feel the movement. Tell me when you hear the movement and you feel the vibrations when they start. You hear it? Say yes.
Yes.
And I'm going to wait a little bit, and we're going to wait for the tuning fork to stop vibrating. Okay, do you feel it stop?
Yeah.
Okay, and again, I'm going to do it on the other side. I'm going to put it on the mastoid. This is a bone right here. It's going to be vibrating. So I'm going to put it here. You're going to tell me when you hear it.
I hear it.
Okay, good girl. And you tell me when you stop. Just wait a little bit. I'll tell you when. When you stop, when my finger stops then, okay?
It stopped.
Okay, so she has the capacity to both hear the ringing and feel the sensation. So again, this is a potential event. It's 20 seconds to hear and 20 seconds to stop, which means that this is a normal hearing and sensation, both for air conduction and bone conduction. So this is the normal. So the 45, the air conduction is 45 seconds, the normal, and the bone conduction is 20 seconds normal. And this is called the Rhine test, okay? So the air conduction is twice as much as the bone conduction. So here we are. Okay. Now what we're going to do is tuning fork, okay. We're going to do the hearing, the otoscope, which sadly enough I tried to get to no avail. This is the otoscope, and I'm going to, via the otoscope, I'm going to visualize the ear canal, the membrane. the tympanic membrane. So I'm going to do this and put it in, and I'm going to look at the area. Okay, and the tympanic membrane is pearly gray. I don't see any exudate. I don't see any pus. Okay, it looks nice and clear. Is this tender to touch at all, baby?
No.
Okay, I don't see anything, any tenderness, any redness, either in the external ear. And I'm going to go ahead and look at the other side once again. Okay, very good. And again, I'm looking in the ear. There is no exudate. There is no noted drainage. I see a little bit of cerumen, which is common to see. Again, looks like it's pretty intact. Okay. So now I'm going to assess the nose. I'm going to see the external nose. Is it symmetrical? Is there any obvious deviation, any swelling, any erythema noted in the external areas? Do you have any allergies?
No.
Any runny nose?
No.
She's a healthy girl. Okay, so what I'm going to look at is palpate it, just touch it to assess to see if there is any pain at all when I do this.
No.
Any pain when I move this?
No.
Okay. Now what I'm going to see is I'm going to look inside the nose to look at the area. Okay, nice and pink. No drainage. I don't see any polyps. Again, same thing here. Pink, no drainage, no polyps, and no septal deviation. She's not complaining of any problems. Okay, touch one side of the nose and breathe. Okay, and touch the other side of the nose and breathe for me. Can you breathe okay? Any stuffiness at all?
No.
Okay, so this is good. There is no obstruction noted nor voiced by the patient. Okay, now what I'm going to do is, I'm gonna believe this is alcohol. And I'm going to, goodness gracious. Okay, I'm gonna close your eyes, and I want to basically check the olfactory capacity, and you're gonna smell this. What does it smell like?
Alcohol.
Good girl. Okay, and I'm going to get something that I dubbed with coffee. Okay, smell it. And what does it smell like?
Coffee.
Excellent. Okay, so she's able to detect the various olfactory smells, alcohol and coffee. Okay, already assessed for polyps, for any obstruction. The mucosa, like I said before, is nice and pink. There is no discharge, no bleeding from the side, and no foreign bodies. Now what I'm going to see is the facial nerves. I would like you to try to go ahead and give me a nice smile. Nice smile, very good. Now I want you to frown for me. Frown. Frown, very good. Now I want you to purse your lips like if you were gonna kiss, and then blow through your lips. Very good. Now I want you to pop your cheeks like this. Okay, no, don't you pop them. Keep them like that. Pop them again. And don't allow me to close it. Keep it. Very good, very good. Okay, so she's able to maintain that position with resistance. what I'm going to do is look at the inside of the mouth with this. And open your mouth. Stick out your tongue. Okay. Stick out your tongue. Okay. Okay. Your tongue out, up, up. Lift it up, your tongue. Lift it up. I want to see. There you go. I don't see any lesions. Go back and stick out your tongue again. Gag reflex. I don't want to go the back, but I know she's got that. Vagus, the uvula is quite centered. I don't want her to gag. So that will test the glossopharyngeal nerve also. So she's able to say and do that. Now, what I want you to do is stick your tongue out. Stick your tongue to the side of your mouth and try to push it, and then go on the other side and push, and this is going to test the hypoglossal nerve. Now, like I said, there are no lesions noted. The tonsils are intact. Do you go to the dentist regular in dental visits?
Yes.
Yes, so you make sure you check your teeth and take care of your teeth. That's part of the oral health. Now and she's intact. So what I'm going to do right now is check for the lymph node. Okay, I'm going to do the posterior lymph nodes. You can stay like that. Posterior lymph nodes, cervical lymph nodes. I don't palpate any. Postauricular. I don't feel any postauricular or periauricular lymph nodes. I don't feel any lymph nodes over here. Okay, and nor any lymph node over here. Now and then I'm going to, since I am here, I'm going to go ahead and feel for your thyroid. Go ahead and swallow up and down. There you go. No thyromegaly. Again, she's a young girl, but she's obviously not complaining of heat or palpitations, anything that would say, or hair loss or brittle nails, anything that would signify any thyroid concerns. So I'm going to check, go ahead, baby, I'm going to check here. I'm going to check here, mama. Lift up your arms, and I'm going to check the lymph from the axilla. Okay, and okay, the epitrochlear lymph nodes. None. Okay. And what I would like to do is, what I'm going to do is just check here. Okay, right down here. And these are lymph nodes from the inguinal area. And again, I am not palpating any lymph nodes at all in that inguinal area. You also see that the trachea is midline. There is no shift at all. And the thyroid is a good size. Again, no nodules noted. And she's able to swallow without any difficulty. No exophthalmos and no abnormalities noted. So I'm going to go ahead, since I am right here, I'm going to go ahead and you're going to shrug your shoulders, and I'm going to put pressure. So keep me from pushing there you go. So she's able to shrug the shoulders and maintain some resistance. Since you're sitting there, I'm going to go ahead and check the back for what we evaluate for any problems with your kidneys or pyelonephritis. Do you feel any pain when I do this?
No.
No pain? Okay. So CVA tenderness is negative. Okay. Okay, now what I'm going to do is push my hands with your head. There you go. Again, push again my head. Very good. Now, turn your head from side to side with resistance. Go ahead, turn it. No, yeah, resist. Okay, resist. Keep it like that.
Oh.
There you go. On the other side, keep it like that. So she's able to turn the head and still have resistance. What I'm going to do is, since I'm here at the neck, I'm going to go ahead and listen for the for the carotid pulses, and of course you're going to not occlude the carotids bilaterally. Here you are. And I'm going to listen. Okay. Hold your breath. And I'm going to listen to the other side. Nice and clear, no bruits noted. Okay. Thorax. I'm just going to look at her chest. It's no noted distress. I don't see any retractions. She's not complaining of, do you feel short of breath? Can you breathe okay?
I can breathe okay.
Okay. So the respiratory rate is normal, 16. She's not complaining of any chest pain. Okay. No crepitus noted. Okay. Okay. What I want you to do is repeat after me. Say, straighten your back out, Mama. You're all crooked. So say 99.
99.
Very good. Again.
99.
Again.
99.
Okay. And I'm going to just put my hand here because she's... Again, say 99.
99.
Okay.
99.
Okay. So palms are open and I check, and tactile fremitus. Now what I'm going to do is take a deep breath. Okay, hold on, Mommy. Nobody's going to see this. Okay, I'm going to... Okay, hold on. I'm sorry. Okay, good. Thank you, Mama. Go ahead, take it. Yes, there you go. Straighten your back and take a deep breath. Deep breath. Again. Okay. My hands are spread equally with every breath taken. I'm going to percuss the back with my little hammer. Okay. Okay, Mommy, I know this is so, if you can sit, yeah, there you go. I'm sorry.
It's okay.
Okay. Okay. Okay. Okay, so I am percussing, and there is resonance, which is well known, that is part of the normal sounds of air in the lungs. Well, she held her breath. Now back, percuss with hammer, breath in and out. Okay, so it's basically the percussion with the hammer, the breath in and out equals to more or less 4 centimeters. Now, lungs. What I'm going to do now is auscultate and listen to the long sounds. Okay. Take a deep breath with your mouth open. Good. Again. Good girl. Again. With your mouth open. Just normal breathing, but with your mouth open. Go ahead. Breathe. Again. Very good. Deep breathe with your mouth open. Just normal breathing. When you move, I hear those movements. So, okay. Good. Excellent. Breathe. Again, breathe. Okay. Again. Exhale. Good. Long sounds are clear bilaterally, anterior and posteriorly. No rhonchi, no rails, nothing of that nature auscultated. Now, to start my cardiovascular examination or assessment, I can see this young lady has mucous membranes are pink and moist, no cyanosis noted. And let me see, Mama, let me see you. Capillary refill is normal, less than 3 seconds. Let me see your foot, Mama. Okay, okay, okay. I see no edema at all. I will check the pulses later. I'm going to go ahead and obviously, come on. This is uncomfortable. Go ahead and relax for me. Any pain when I do this over here?
No.
No pain. And I'm just going to check for, okay. Pedal pulses present. Any pain when I do this back here?
No.
Holman sign negative, and capillary field less than 3 seconds. Okay, so now if I'm sorry, I got so many books here. I'm gonna have you go ahead and if you can lay on this side and facing that way, because I'm gonna have to check your.
Wait, so like
Or-
this?
Well, come on, it's okay. Sit up first. I'll check you a little bit later. What I'm gonna do is I'm gonna check the carotid with the apical pulse. I'm sorry, Mama. Okay, I'm just gonna feel here. Okay. Same rhythm, no bruits noted. Okay. maxillary and precordium. And go ahead, and I'm going to check your precordium. Okay, right, left side. Okay, you're gonna, yeah, go ahead. Okay, stay close to me, bring yourself closer to me. Okay, and I'm going to check the precordium. Wait, the precordium. Okay. 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 A nice, apparently normal rhythm. No bruits noted. Come on, sit up again, mommy. I'm sorry, baby. Okay. Now, I'm gonna check the different pulses. Okay. I'm gonna have to go underneath. Aortic. Pulmonic. Okay. Ay, caramba. The tricuspid. And the mitral. Okay. I hear S1 and S2. No murmurs, no clicks. And I don't see any jugular venous distension. Okay. And the pulses. Well, I checked the pedal pulses. I checked already the brachial. I'm gonna check the different pulses right now. The brachial pulses. Okay, where's my little thing? I may not elicit them. Okay, just leave it like that. Okay, just let it drop. Just let it drop. Yeah. Okay, so they are. Okay, 2 pulses. Bilaterally. The femoral, popliteal, I already did that. The pedal pulses, popliteal pulses. I'm gonna just check again. It's so difficult. Okay, they're present. Okay, I'm gonna check the pedal pulses. And I'm gonna check here, Mama. I'm just gonna feel, just open your arms just a little bit. I'm just gonna, you got some pulses here. And the brachial pulses, okay. Now, I'm gonna check the gastrointestinal. Mama, do you have any burning or move, the food comes up?
No.
Any acid stuff coming up after you eat or where you lay down?
No.
Any nausea, vomiting?
No.
You go to the bathroom, okay, to have a bowel movement?
Yes.
Okay, when was the last time?
Today.
Thank God she remembers. Okay. Go ahead and lay down now, face up for me.
Yes.
Face up, up.
Oh yeah.
Goodness gracious. Up, totally up, not on the side. There you go. So I'm going to expose her tummy a little bit. Just relax, yeah. Well, the stomach looks normal, no bulges. Just relax. Okay, she's sleepy. Okay, and no umbilical cyanosis or ecchymotic areas. I'm going to now auscultate. I'm going to listen for your bowel sounds. Okay. Positive. Bowel sounds are present in all 4 quadrants. And what I'm going to do now is I'm going to just palpate here. Any pain at all?
No.
Any pain?
No.
Any pain?
No.
Healthy girl. Healthy 10-year-old. No pains at all. Okay, so I'm going to okay, just check. Take a deep breath. Take a deep breath in and hold it for me. Hold it. Hold it. Okay. Normal, maybe the liver edge very slightly palpated. No tenderness. Go ahead and relax. Okay. Okay. I'm going to just listen here momentarily. Okay. 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 Sounds good. I'm going to now listen to the different vessels in the abdomen. The aorta. Okay, just relax for me. Okay. Okay, hold on. Let's see. Let me get my. Okay. Okay. The aorta. Renal arteries. Iliac. And again, I am ready. Okay. Okay. No bruits noted. Go ahead, baby. Thank you. Okay. Now, spleen. Okay, right lower quadrant. And she's no pain whatsoever in any of the 4 quadrants. The spleen is again normal. I don't palpate it. It's not enlarged, and again the sounds it's of the liver is. Lay back down again. I'm going to listen to something else again. Okay. I'm sorry, I can't. Okay, it's dull here. Okay, this is within the norm. Okay, now I think I've done all this. Okay, now what we're gonna do, go ahead baby, stand up for me baby. Thank you, I know you're falling asleep. Don't fall asleep, you're on camera. Okay, stand up. What I want you to do now is I want you to walk from there to here. Just walk towards me and turn back around. Very good. Okay, now walk on your heels. Very good. And walk on your tiptoes. Back there again. Now walk from heel to toes. Heels to toes. Very good. Now what I want you to do is one little thing. Go back to the front and try to touch your toes here so the camera can see you. Try to touch your toes, crouching down. No. Normal, just try to go forward. No, and touch your toes. No, don't squat. Okay. There you go. I don't see any curvatures of the spine. I don't see any scoliosis, and she's got, actually, thank you so much. She's got actually good range of motion. Okay, now sit over here for me. There you go. Now what I'm going to check is cerebral function. I want you to touch your nose with one finger, then go like this. Toom, toom, toom. Stretch, toom. Your nose. There you go. Very good. Now what I want you to do is touch each finger with the thumb. So you're going to touch each finger with the thumb. Now the other hand. Okay. Okay. Touch my finger with your index. Very good. Now with your index, touch my finger and then touch your nose. Thumb, your nose, and touch in, and your nose, and go the other hand. There you go. Touch and touch your nose again. So that is pretty good. Now with your eyes closed, I want you to try to, with your heel, try to touch your shin. With the heel, your shin, right here. You're really going above the Call of Duty. Go ahead, touch your shin over here. There you go. And the other foot again, touch your shin with the other foot. Okay, now what I'm going to do is I want you to tell me whether, with your eyes closed, I want you to tell me if you feel anything sharp or dull. So let me see this part of your arm. And this is all making sure your nerves are. Close your eyes. Now, okay. Is this sharp?
Yeah.
Okay. And is this dull or what? Is it sharp or dull?
Dull.
Okay, let me see the other forearm. Okay. Oh yeah, this is sharp. Okay. Okay. Whoa. Okay. Now, close your eyes. Tell me if this is sharp or dull.
Sharp.
Okay. And tell me what you feel. Is this sharp or dull?
Dull.
Okay, very good. Now, give me your hand. Yeah, close your eyes. And you're going to tell me if you feel it sharp or dull.
Sharp.
Okay. And what is this?
Dull.
Okay, very good. So I think we have the cerebral function. Okay, you can open your eyes now. Okay. Okay, now move your with your eyes closed, move your joints up and down your forearm. Do this and just move them nicely. Okay. Touch with cotton, right foot, left calf. Okay. Now I want you to tell me what you feel here, sensation-wise, your right foot. Okay. Here. What do you feel here?
Liquid.
Like, oh, it's wet. Very good. It's like cotton. And let me see what else. Okay. Cotton and okay. Now tell me what you feel.
Like tissue.
Very good. Okay, very soft. Good sensation. Okay. Now, now I want you to. Okay. Okay, I don't know what I need. I need something. Okay. Now what I want you to do is close your eyes right now. Okay, and I'm going to put something in your hand, and what I'm trying to do is assess for sternocleidosis. Close your eyes and tell me more or less what you feel here. What is this?
A penny.
Very good. It's close to a penny, and it's a metal button. And what do you feel here? No, only with one hand. Tell me what you feel.
A paper clip.
Very good. Excellent. Okay, so she's able to both feel both things. Now what I'm going to do is I'm going to write a letter in your hand, and that's graphethnia, just to make sure that she's able to record with your eyes closed. What letter am I writing here?
C.
Okay, and the other hand, let me see if I can do this, and open your palm so I can, okay, and what letter am I doing here?
E. A.
Very good. And letter A, so she gets straight A's for that. And reflexes, okay, let me see if I can strike toes downwards. Okay, and let me see one more little reflexes. Okay, very good. Hold on. And, well, bottom of foot. Well, she's got intact reflexes. So at this point, I have, with great effort, with the help of my little assistant and my other little assistant, hopefully I have conquered this head to toe assessment. It has been a learning experience. And thank you very much. That's it. Thank you guys. Appreciate it.